السلام عليكم. محاضرة الأسبوع الثالث من الكارديوفاسكولار سيستم باثولوجي هي Valvular heart disease. From anatomical point of view, we have four types of valve in the heart: mitral, aortic, pulmonary, and tricuspid valve. Valvular heart disease means any disease that affects any of the aforementioned valve, results in stenosis or insufficiency or both. Valvular insufficiency, in another word, regurgitation or incompetence. Stenosis is the failure of the valve to open completely, obstructing forward flow. Valvular stenosis is almost always due to primary caspal abnormality and is virtually always a chronic process, while insufficiency resulting from failure of the valve to close completely, thereby allowing regurgitation, backflow of blood. Valvular insufficiency can result from either intrinsic disease of the valve cusps or disruption of the supporting structures without primary caspal injury. فهنا ان الاستينوسيس والانسufficiency الديفينيشن is very important حتى تعرفوا الميكانيزم and pathology of both. فهنا الاستينوسيس هو failure of the valve to open completely, while insufficiency failure of the valve to close. يعني معناها هذه الاستينوسيس هو عكس الباثولوجي اوف stenosis، هو عكس الانسufficiency. والكوزز ولازم بالستينوسيس usual due to primary caspal abnormality, while insufficiency either primary caspal abnormality or disruption of the supporting structure without any primary disease of the valve cusp itself. هنا schematic representation of type of valve disease. الستينوسيس هذه معناها narrowing in the opening of the valve, while regurgitation there is widening in the opening of the valve. هنا narrowing prevent forward flow, while regurg there is a backward flow بالاتجاه المعاكس، راح البلد راح يتجه بالاتجاه المعاكس. The principal causes: valve stenosis, congenital, rheumatic carditis, or senile degeneration due to aging. معناها senile aging. While valvular regurgitation either congenital, rheumatic carditis acute or chronic اللي راح نعرفها بهذه المحاضرة. Infective endocarditis, valve ring dilatation in dilated cardiomyopathy, syphilitic aortitis, traumatic valve rupture, damage to chorda and papillary muscle, or senile degeneration. فهنا الكوزز اللي تسوي both valve stenosis or regurgitation هنا عندنا congenital, rheumatic carditis, and senile. Trauma most commonly produce valvular regurgitation. And infective endocarditis also cause valve regurg. Valvular stenosis, this is the schematic representation. This is the valve. There is stenosis or narrowing, prevention of forward flow of the blood, so there is a pressure on the valve itself for creating a condition of pressure overload. This is the pressure overload on the valve in the case of valvular stenosis. While valvular regurgitation هنا عكس الستينوسيس الباثولوجي, there is widening, failure of the valve to close, resulting in backward flow of the blood in the opposite direction, creating volume overload on the atrium. Complication of valvular heart disease: hemodynamic instability, heart failure, angina, syncope, or death. Calcific aortic stenosis refers to the narrowing of the aortic valve orifice due to calcium deposition in the valve cusp and ring, so creating the calcific aortic stenosis. Etiological factor: rheumatic aortic valve disease, degenerative senile calcific stenosis, or congenital bicuspid aortic stenosis. So, calcific aortic stenosis, it's the aortic stenosis due to calcification from the name, due to the primary cause of the aortic stenosis, due to calcification. This is the valve and this is the calcium deposit on the valve ring. Pathological calcification, there are two types, either dystrophic calcification or metastatic calcification. Dystrophic calcification, when the deposition occur, yani calcium deposition occur in dead tissue in the absence of abnormality in calcium metabolism. Dead tissue mean يعني which type of tissue? mean all type of necrosis, atherosclerosis اللي راح ناخدها بالدروس القادمة, area of intimal injury in aorta or large arteries. So calcium deposition in this area, in these areas of the body, called dystrophic calcification. By itself, it can cause organ dysfunction. فالpathogenesis of dystrophic calcification, first step there is an initiation or nucleation, فالكالسيوم راح يلقى مكان حتى dead tissue لأجل أن يبدي deposition, then propagation, then deposition time by time, so it's a progressive process. Metastatic calcification, it can occur in normal tissue whenever there is hypercalcemia. فهنا الفرق بين dystrophic calcification and metastatic calcification in normal tissue where there is hypercalcemia. Four major causes of hypercalcemia, like these causes. Feminine causes cause raising in serum calcium level, resulting in the metastatic calcification. The clinical consequence of valvular dysfunction depending on هنا clinical consequence, هنا عندنا valvular heart disease, valvular pathology. Clinical consequence, symptoms, disease, resulting disease depend on four factors. The valve involved, which valve, which is aortic or mitral, tricuspid or pulmonary, the degree of impairment, when there is mild, severe, moderate, severe, how fast is developed, acute or chronic, what rate and quality of compensatory mechanism. In the body there is a compensatory mechanism against valvular disease or any disease in the body. When this compensatory mechanism disrupted, so the pathology occur. Rheumatic fever and rheumatic heart disease. Rheumatic fever is an acute immunologically mediated multi-system inflammatory disease that occur a few weeks, 10 days to 6 weeks following an episode of Group A streptococcal pharyngitis. It occurs in only 3% of patients with streptococcal pharyngitis. It can occur at any age group, but the peak age is from 5 to 15, يعني in children. Young children and adults can also develop the disease. فهنا rheumatic fever هي acute disease. The causes or pathogenesis هو immunologically mediated. Which type of the immunological disease? It's an autoimmune, mean the body regard the self-protein as an foreign protein and producing an immunological system against self-protein. usually occurred, usually the clinical scenario, a child with pharyngitis 10 days to 6 weeks after pharyngitis developing the sign and symptoms of rheumatic fever. Pathogenesis. The pathogenesis of acute rheumatic fever is not fully understood. However, an autoimmune response against self-antigen is the most favored or most accepted mechanism. It's strongly suggested that acute rheumatic fever is hypersensitivity reaction induced by group A streptococci. Antibody against M protein of group A streptococci cross-react with normal protein present in the heart, joint and other tissue. فهنا عندنا بالبداية there is an infection with group A streptococci. هذا الانفكشن create an immune response. هذا immune response manifested by T cell and then B cell will B cell produce an antibody. هذا الانتيبودي راح يروح فوكس and يحارب الجروب A streptococci اللي هي foreign protein اللي هي الانتيجين او foreign protein البكتيريال بروتين حتى يحاربها ويقضي عليها. لكن بحالة الروماتيك فيفر هذه الانتيبودي راح تروح مو فقط تحارب البروتين of the bacteria لكن also راح تحارب بروتين normally موجود in the body اللي هي بالهارت. فش راح يسبب؟ راح يسوي injury للبروتين الجروب A streptococcal بروتين in the same time راح يسوي لنا injury للهارت. فهذه هو الميكانيزم of autoimmunity اللي معناها البادي regard self antigen as a foreign protein and then react with it. The symptoms begin 2 to 3 weeks after infection as we mentioned. Detection of antibody streptococcal enzyme like streptolysin O and DNase in sera of patient. This is the pathogenesis schematic representation. This is the clinical scenario هو pharyngitis, colonization of streptococcal antigen بالpharynx producing pharyngitis. هذه immunological consequence راح يسوي لنا T cell activation و then B cell activation. هذه البي cell ايش راح تسوي؟ راح produce antibody. هذه الانتيبودي directed against هذه الجروب A streptococcal protein. It's not only directed against streptococcal group A streptococcal protein. Also هذه الانتيبودي راح تروح وتحارب الميوكارديال سيل بروتين موجود بالميوكارديال سيل وبالهارت فالف producing the myocarditis valvulitis اللي هي rheumatic fever اللي احنا قلنا هي acute disease following group A streptococcal antigen infection. لكن بالrepeated antigen exposure لما يكون مرة أخرى راح هذا الطفل اللي صار به pharyngitis بعدين صار عنده rheumatic fever acute rheumatic fever و it's self-limited somewhat self-limited disease then cured but after repeated exposure إذا صادف هو مرة أخرى راح صار infection with group A beta hemolytic streptococci راح يعطينا الكونديشن of the chronic rheumatic heart disease valvular heart disease اللي هي أخطر more serious than acute rheumatic heart disease. لذلك any patient, any child with acute rheumatic fever and the history of acute rheumatic fever راح يظل under close observation. راح يعطوا antibiotic monthly. Also good oral hygiene is very important to prevent a reinfection and then prevention of the chronic rheumatic heart disease. Pathology of acute rheumatic fever. acute rheumatic heart disease is a pancarditis that involve all three layers of the heart: endocardium, myocardium and pericardium. كلمة pan معناها كل جميع، فpancarditis معناها all three layer: endocardium the innermost layer lining of the heart, the myocardium the in between muscle, and the pericardium the outermost layer. Myocarditis يعني pathology of myocarditis بالcardiac muscle middle layer. Characteristically, there is an Aschoff body. Aschoff body is a characteristic granulomatous lesion of the rheumatic myocarditis developing several weeks after symptoms began. This structure initially consists of a perivascular focus of swollen eosinophilic collagen surrounded by lymphocyte, plasma cell, and macrophage. With time, Aschoff body assumes a granulomatous appearance with a central fibrinoid focus associated with a perimeter of lymphocyte, plasma cell, and macrophage. Eventually, Aschoff body replaced by nodule of scar tissue. This is the schematic representation of an Aschoff body. هذه كلها Aschoff body وهذه histological picture under microscope post-mortem examination of the myocardium. فهذه احنا central focus of collagen fiber and fibrinoid necrosis. يكون necrosis باللي center surrounded by perimeter of lymphocyte, plasma cell, macrophage. ذني شنو ذني السيلز؟ chronic inflammatory cells. chronic inflammatory cells. هذه الأشوف cell هي macrophage وهذه histological picture. الcentral هذا الcenter necrosis appear as an eosinophilic structureless materials in the center وهذه هي surrounded by lymphocyte, plasma cell والماكروفاج. الليمفوسات هذه الصغيرة اللي تبين as dark dot، هذه الماكروفاج اللي هي كبيرة، السيل الكبيرة هي الماكروفاج. Anitschkow cells أكو عندنا Anitschkow cells is an unusual cell within the Aschoff body. Those nuclei contain a central band of chromatin. These nuclei have an owl eye appearance and cross section, and they resemble a caterpillar when cut longitudinally. Anitschkow cells may become multinucleated, in which they are termed an Aschoff giant cell. هذه هي sometime we see Anitschkow cell اللي هي أصلها شنو هي which type of cell هي histiocyte شنو معناها macrophage بالبلد من تصير بالتشو راح نسميها histiocyte. احنا قلنا ال component of Aschoff body اللي هي central collagen and fibrinoid necrosis surrounding اللي 3 cell type اللي هي chronic inflammatory cell اللي هي lymphocyte, plasma cell and histiocyte. sometime نسميها Aschoff cell. sometime هذه الهيستيوسايت راح تكون شوية شكلها غريب عن الهيستيوسايت العادية اللي نشوفها، انه هي راح تكون النيوكليوس عندها central band of chromatin. transverse cutting transverse section من نسويها قطع cutting transversely راح تبين an owl eye تشبه الاول eye، ولكن باللونجيتودينال سكشن من القطع يكون لونجيتودينالي راح يشبه الكاتربيلر، لكن في اليرقة تشوفوها caterpillar so called Anitschkow cells. فاحنا which is Anitschkow cell is an unusual cell اصلها شنو histiocyte inside the Aschoff body. هاي الأشوف body وين تصير بالروماتيك characteristic of rheumatic carditis myocarditis. حكينا عن المايوكاردايتس، احنا عندنا قلنا involve pancarditis بالروماتيك fever all 3 layer، فاحنا pericarditis also inflammation of the pericardium, this irregular fibrins also present. These exudates resemble the shaggy surface of two slices of butter bread and have been pulled apart like sandwich يسموها bread and butter pericarditis. Ordinary does not lead to constrictive pericarditis. And the third layer also is an endocarditis. Left معناها شنو endocarditis in the endocardium والlining or the inner lining, innermost layer lining the heart, also the valve. Left-sided valve are most injured because they close under greater pressure than do right-sided valve. This led to the deposition of tiny nodule of fibrin which can be recognized grossly as verruca. تسمى verruca اللي هي عبارة عن شنو؟ عبارة عن clot راح deposition of a clot بالvalve تسمى verruca along the leaflet, so-called verrucous endocarditis of acute rheumatic fever. فverruca mean deposition of the clot when heart valve. Left-sided valve are most commonly injured in acute rheumatic fever. هنا as we mentioned in this schematic representation عرفنا الباثوجينيسيس اللي هو عن autoimmune process. pathogenesis هو mechanism of action of this disease, how the disease occurred. قلنا الكوز هو عن autoimmunity. الباثولوجي اللي هي شنو الفايندينج اللي راح نشوفها either grossly or microscopically. راح نشوف Pancarditis يعني all three layer اللي هي بالمايوكارديوم اللي also احنا المايوكارديوم عندنا والهارت فالف نفسها. راح يكون عندنا vegetation. قلنا vegetation بالمحاضرة السابقة هي when there is a clotting deposition بالهارت فالف يسموها vegetation. وعندنا myocarditis اللي characteristically اكو هذا البدي موجود اللي شرحناه هو called Aschoff body characteristically occurred in the myocarditis of acute rheumatic fever. وعندنا pericarditis اسمها شرح pericarditis هو fibrinous pericarditis due to presence of fibrin in the pericardial space وقلنا like a sandwich. Grossly pathogens sequence and key morphological feature of this is the of acute rheumatic disease, heart disease. قلنا rheumatic heart disease is a systemic process, not also only involve the heart, but most common manifestation or involvement of the heart. It also affect the joint, arthritis of the large joint, also lung, chronic interstitial inflammation, also skin, subcutaneous nodule or erythema nodosum. Now, chronic rheumatic heart disease characterized by organization of the acute inflammation and subsequent scarring. Aschoff body replaced by fibrous scar, so that these lesions are rarely seen in chronic rheumatic heart disease. Most characteristically, valve casts and leaflets become permanently thickened and retracted. فهذه الفرق بين الكرونيك هو مهمة عن الأكيوت هارت ديزيز. احنا بالكرونيك راح ما نشوف الأشوف بدي. ليش؟ replaced by scar, fibrous scar. There is an organization of the inflammation و fibrous scarring. Also بالvalve راح نشوف permanent thickening و retraction of the valve. وهذه الحالة احنا ما نشوفها بالacute rheumatic fever. The most important functional consequence of rheumatic heart disease is valvular stenosis and regurgitation. Stenosis tends to predominate. هنا قلنا valvular heart disease in general either stenosis or regurgitation. لا بالrheumatic heart disease بالchronic rheumatic heart disease commonly stenosis. Most common pathology in most common valvular heart disease هو valvular stenosis. هسه which valve involved? The mitral valve alone is involved in 70% of cases, with combined mitral and aortic disease in another 25%. The cusps valve usually is less frequently and less severely involved, while the pulmonary valve are most always spared, escape the injury. Not involve the chronic rheumatic heart disease, doesn't involve the pulmonary valve. Most common valve affected is the mitral valve. Chronic rheumatic mitral valvulitis قلنا most common valve involved هو mitral, و most common pathology in valvular heart disease هو mitral stenosis. Valve leaflet and chorda tendina are thick, rigid and interadherent. Thickening اللي هي characteristic feature of the chronic rheumatic heart disease. Valve orifice narrowed to slit-like channel forming fish mouth deformity. It's like fish mouth grossly. Left atrial dilated and hypertrophic atrial fibrillation. ليش؟ لأن mitral valve من يكون stenosis راح يكون pressure overload بال left atrium causing dilatation to compensate the injury, to compensate the high pressure due to mitral stenosis, and become then hypertrophy اللي معناها المسل increase in the size of the muscle حتى تعوض البريشر الزايد عليها. ف then there is atrial fibrillation ending in atrial fibrillation اللي هي arrhythmia, type of arrhythmia. Mural thrombi may be present, forming source for systemic emboli. Sometimes mural thrombi present in a mural thrombi, any type of thrombus that present adhere to the heart chamber, or sometimes become a source for systemic embolization. In long-standing cases, left ventricle dilated and then become hypertrophied. This is the gross picture in acute rheumatic mitral valvitis superimposed on chronic rheumatic heart disease. It's a small vegetation اللي احنا قلنا هذه الفيجيتيشن شو نسميها بالروماتيك heart disease؟ نسميها verruca. هذه الفيجيتيشن موجودة على الهارت valve بالmitral valve along the line of occlusion. This is the rheumatic valvulitis. The mitral valve leaflets are thickened and focally calcified. This is the chronic disease, chronic rheumatic disease. There is a thickening هو characteristic pathology, permanent thickening, and then calcification, with a partial fusion of the commissure. Complication of the chronic rheumatic heart disease. Neural thrombi قلنا أن thrombi adhere to the heart valve, congestive heart failure, adhesive pericarditis, commonly followed fibrinous pericarditis. Infective endocarditis is infection of the cardiac valves or mural surface of the endocardium characterized by vegetation forming adherent bulky mass of thrombotic debris. So from the name infective endo, it's an infection of the cardiac valve or the endocardium. Types of infective endocarditis: acute infective endocarditis or subacute infective endocarditis. Acute is a rapidly progressive caused by infection by high virulence microorganisms such as Staph aureus. The normal cardiac valve can be involved. It's associated with little host reaction. While subacute infective endocarditis is slowly progressive infection caused by low virulence microorganisms such as alpha hemolytic streptococci. It affects the normal cardiac valve characterized by local inflammatory reaction and granulation tissue. فهذه إنه الacute was a rapidly progressive و high virulence microorganism, while the subacute is caused by usually slowly progressive infection caused by low virulence microorganism. Pathogenesis. Either local valve abnormality leading to the endothelial injury causing fibrin and platelet aggregation, forming source for microorganism. Local valve abnormality, injury, trauma causing the source for the microorganism and infection, or bacteremia from either intravenous drug abuser or infection elsewhere in the body or from the skin, from any source. Then there is a bacteremia causing the infective endocarditis. Predisposing factor, either cardiac abnormality, rheumatic heart disease. Patient with rheumatic heart disease are most susceptible to infective endocarditis. Mitral valve collapse, degenerative calcific aortic stenosis. هذه معناها cardiac abnormality. There is an abnormality primary cause. Valve replacement surgery, those with prosthetic valve, or intravenous drug abuser affecting a previously normal heart, even there is no primary abnormality بالheart or heart valve. Pathological feature, acute infective endocarditis, solitary bulky friable vegetations consisting of fibrin, platelet and microorganism. هنا بالinfective endocarditis اكو فرق عن الروماتيك vegetation اللي يسموها فيروكا rheumatic vegetation. هي عادة بالinfective endocarditis there is bulky, the size more sizable, producing more sizable vegetation and more friable, يعني commonly more susceptible to be an embolism, to embolize elsewhere, consisting of fibrin, platelet, also microorganism. Then there is an infection for microorganism. Ring abscess with myocardial extension, sometimes they're producing a ring abscess in the valve ring. Neutrophilic inflammatory cell infiltrate, an acute inflammatory cell واللي هي component of acute inflammation هو neutrophil، فهنشوف neutrophilic inflammatory cell infiltrate. Sometimes systemic emboli to distal side to the brain, kidney, myocardium, and abscess formation at site of infection, also producing either systemic emboli or to distal sites or abscess at a site of infection. Subacute infective endocarditis. The vegetation اللي هي معناها الترومباي or clotting are firmer and less valve destruction. راح تكون قلنا بالacute هي friable softer than the subacute infective endocarditis. هنا لا بالعكس الترومبس تكون firmer and less valve destruction. Myocardial extension is less common, ring abscess is less common, where granulation tissue formation, where systemic emboli with less abscess formation. This is the important distinctive feature between acute and subacute infective endocarditis. 50% to 60% of cases of endocarditis occurring on damaged or deformed valve are caused by streptococcal viridian, a relatively panel group of normal oral flora normally present in the mouth. By contrast, the more virulent Staph aureus can attack deformed as well as healthy valve and is responsible for 10 to 20% of cases overall. It's also the major offender in infection occurring in intravenous drug abuser. So in intravenous drug abuser, the most commonly likely the pathogen هو Staph aureus. Also it can attack deformed as well as normal valve because of high virulency of this microorganism. While in the case of damaged or deformed valve, most likely microorganism هو الستريبتوكوكس فيريدان اللي هي normal flora oral flora. Aortic and mitral valve are the most common site of infection, although the tricuspid valve is a frequent target in the setting of intravenous drug abuse. Vegetation may be single or multiple and may involve more than one valve. They can sometimes erode, produce erosion, destruction of the valve itself. This is the gross picture in infective endocarditis. This is the endocarditis of the mitral valve. هاي احنا نشوفها الفيجيتيشن التومبال كلوت الموجودة بالmitral valve. هنا acute endocarditis of congenitally bypass aortic valve with extensive cuspal destruction and ring abscess, producing a ring abscess in the ring of the valve and destruction. This is the histological appearance of vegetation of endocarditis with extensive acute inflammation. راح نشوف common or the most common cells present here neutrophil اللي هي acute inflammatory cells. هنا gross picture of healed infective endocarditis producing scar. هذه هو اللي بين as a white color produce thickening and scar formation. Non-bacterial thrombotic endocarditis is a non-bacterial thrombotic endocarditis, also known as Rheumatic endocarditis is another name, refers to the sterile vegetation on apparently normal cardiac valve. Sterile mean there is a non-infective من اسمها non-bacterial. It's a non-infective معناها الفيجيتيشن الكلوت or thrombi هي sterile ماكو microorganism و on apparently normal cardiac valve. Valve normal, not damaged, not prosthetic. Small masses of fibrin, platelet and red blood cell here component of the blood clot thrombus on endocardial surface. No bacteria seen, so it's a sterile. The name is sterile. Predisposing factor malignancy, especially adenocarcinoma, hypercoagulative state, wasting disease, disabling patient called Rheumatic endocarditis. Morphology multiple small nodule along the line of closure. هذه النوديول هي شنو عبارة عن thrombus vegetation usually small less than 5 mm. Mitral is the most common affected valve. Microscopically fibrin deposition, platelet aggregation and RBC. Inflammation and fibrosis are absent or characteristically absent. ماكو inflammation, ماكو infection وماكو fibrosis. Spontaneous resolution can occur. This is the non-bacterial thrombotic endocarditis. Is a gross picture after postmortem dissection. Vegetation, هذه الvegetation red color, red mass along the line of closure of the mitral valve. This is the second picture هي a microscopic picture of vegetation. هذه لونها dark red هذا vegetation وهذا هو الفالف. هذا اللايتر هذا الفالف. شوفون الvegetation not firm, it's a loosely attached. هذه شوية space بينها وبين الفالف. loosely attached to the heart valve. usually bland يعني شنو؟ ماكو inflammation, ماكو infection, no fibrosis. Libman-Sacks endocarditis occurred in patient with systemic lupus erythematosus. فهذه characteristic name إذا كانت endocarditis in patient with patient has systemic lupus SLE. الانdocarditis يسمى Libman-Sacks. الvegetation sterile هم ماكو infection. Most common affected valve are mitral and tricas valve. This lesion becomes uncommon with the use of the steroid for treatment of systemic lupus erythematosus. طبعا بالسابق كانت more common هذه الديزيز. هذا الديزيز more common لكن after introduction and the use of the steroid become less common. فهي type of non-bacterial endocarditis. الاسم فقط هو Libman-Sacks معناها تصير بال systemic lupus erythematosus. This is the gross picture postmortem examination of Libman-Sacks. This is the verrucous vegetation, a row on the leaflet of the mitral valve. بالليفلت هذه small masses. dark red mass هي clot or thrombus leaflets of the mitral valve. This is the schematic representation of all formation vegetation. هنا بالcase of rheumatic heart disease شوفون هذه vegetation هي small multiple small mass of vegetation along the line of the closure in one side. هذه الثانية البيكتشر الثانية IE معنى Infective endocarditis. نشوف الفرق هي bulky mass adherent mass تشوفوها و cause destruction valve destruction تشوفوها سوت valve هنا الvalve intact الماس small size multiple along the line of the closure بس هنا variable bulky mass and produce destruction. Nonbacterial thrombotic endocarditis راح تكون في medium sized اللي هي أقل من size of infective وأكثر من size of rheumatic heart valve medial size valve along the line of the closure و characteristically تكون bland ما بيها infection ما بيها organism مثل ما أخذنا definition of the non-bacterial thrombotic endocarditis. هذه type Libman-Sacks endocarditis اللي هي تكون بال systemically lupus erythematosus characterized by small to medium size inflammatory vegetation. characteristically طبعا تشبه ال non-bacterial thrombotic endocarditis تكون bland ما بيها infection لكن الفرق انه on both sides of the leaflet يعني هذه الانتيريال وهذه الليفلت مرفوعة حتى تبين انه also بالposterior surface حسب ما هو مرسوم بهذا الرسم anterior and posterior in both characteristically occurred in both sides of the valve leaflets. Thank you for listening.